now.
So, good evening, everyone. Sorry for the yesterday. Let us start today's class. So, myself, Dr. Suma Joshi. I'm an Ayurvedic BMS doctor with MD Panchkarma, now presently pursuing PhD degree. Okay, fine. So, before starting today's class, let us start with the prayer first. Come to Namaskara Mudra. Gurur Brahma. Ishwaraha. Gurun Sakshat Parabrahma. Tasmai Shri Guve Namaha. Rub your palms, apply to eyes, slowly open your eyes. So, welcome all of you. So, it is first class. So, we will start with the basic terms. So, when we are going in detail, so what happens, there will be many doubts will be coming. There are many questions are there. Everything is there. So we will go basic terms. Then after basic terms, every class after so 1 minute. So after every class, I will take one small meditation session, because there are many types of meditation. If in one class only, if I am telling all the meditation, so it is very difficult for understanding and to remember. So at the end of the class, like 5 minutes or 10 minutes, we will go with the meditation class. So let us start with the today's class. Okay. Yes, sir, मुझे आप होस्ट बनाएंगे तो I can share my PPT, my presentation. Yes. So actually yesterday I forgot to tell you people, along with this class, food and nutrition course is also they are providing, and it is very useful also, very much beneficial. राजीव सर, मुझे आप होस्ट बनाएंगे? I can share my PPT.
ओके जी प्लीज म्यूट ऑल। चेतना जी, राजश्री भाले।
And one more thing, if you are having any doubts, so you are having any doubts, yes, namaste madam, namaste. So if you are having any doubts, so you can ask, you write it down, and even I am providing the PPT in the group. Okay. So, but also if you are having any doubts, just write it down, and you can even you can make your own running notes also. Sometimes what happens, which are which are not present, some of the little things I will be telling in the class. So yes, good evening.
Okay,
Good
ma'am, you
evening.
can share your screen. Just try.
Wait. Yes, I can share. Yes. Thank you. I can share my PPT. So yes, good evening everyone. So is it visible? दिख रहा है सबको?
Yes.
Okay. Okay. Yes. So we will start with the basic terminologies. It starts with, I usually start with all the basic terminologies which are coming during our class. Okay. And and one more thing, my whole class will be actually in English. So if anybody wants anything in Hindi, so they can tell. I can, in between, I can translate and tell you people. Main aim of my aim is, whoever is listening, my students, everyone, they should understand completely. And when they are giving these things to their clients. So that should be perfect. So coming to basic terminologies, first of all, I will go with this one, anatomy part. So what is anatomy? So anatomy actually, it is the study of structure. Whatever we are studying, maybe it is of plant, maybe it is of animal, everything it is called as anatomy, main structure study of the anatomy. But in anatomy part, we are mainly dealing with human anatomy. So it is not only called as anatomy, it is called as human anatomy, which includes the explanation regarding the cells, body organs, body systems, body tissues, and how they are organized in the body. So it is called as human anatomy. Next, coming to physiology. Physiology, it is the actually the science of life. So what happens, what is the difference between anatomy and physiology? See, what I am telling, so they are 5 fingers. So this is called as anatomy, but they can move like this. There is circulation. What the functions they are doing, this is called as physiology. This is the eye. Eye is present here. Eye is located here. All the structures present. See, eyebrows are there. Eyelashes are there. These all things are there. So that is called as anatomy. But what it is doing, it is seeing the objects. It can differentiate between the colors. It can be, differentiate between different items, maybe like human, animal, plants and all. So that is called as physiology. So in total, physiology, it is nothing but understanding of the mechanism of the living things, and from the basis of cell function at the ionic and molecular level to the integrated behavior of the whole body and influence of the external environment. See, suppose one cell is there. Cell contains nucleus and other things. So that is anatomy. But cell is having different functions. That is physiology. From the cell to the whole body, whole system, whole organ, that is called as physiology. So very easy. Then coming to obstetrics and gynecology. Usually, whenever we are dealing with the client, we can tell, we tell that go to your gynecologist, go to your obstetrician, like that we are telling. So what is the difference between that, OBG and gynae? So OBG, it is actually, obstetrics is a branch of medicine that deals with the care of the woman before, during, and after the pregnancy and childbirth. Whereas gynecology, it is the branch of physiology and medicine which deals with the functions and diseases specific to women and girls, especially those affecting the reproductive system. So whenever we are taking for the pregnancy yoga classes, we have to tell that go and contact your obstetrician. So they are dealing with the pregnancy and other things. For example, if any lady is having white discharge, suppose the lady is having any problem related with the menstrual cycle, and if the lady is having any issues, so maybe PCOD or any other things, infertility, so at that time we have to tell to contact gynecologist. So if a lady is having white discharge, so she has to go to the gynecologist. So it is a small difference between obstetrician and gynecologist. So the person who is dealing with the pregnancy and childbirth, that is he or she is called as obstetrician. Nowadays even male doctors are also there. And gynecologist, it is the who is taking care of the woman's health. Then now coming to the this one, so positions of the body. So knowing these positions is very important whenever you are going to teach about the yogasanas. So we are taking yogasana part also, and even other things. So at that time, you should know what is meant by these terms. Supine. Supine is nothing but the person is lying like this and face is looking up. That is called as supine. Or even you can tell in normal terms, sleep on your back. So that is called as supine position. Prone position is nothing but face looking towards the ground. So you can tell sleep on your abdomen, or sleep on your face facing the earth. So that is called as prone. Usually prone position we are not using for the pregnant lady, and even supine also not much, only some during some cases. Okay, you will come to know. Next, coming to uterus. So uterus is nothing but where the baby is there, and it is nothing but woman's womb. Then antenatal and prenatal. So these two terms are actually one and the same. So anti means before and pre is also before. Means it is the term where like uh, it is going on, like the before the birth of the child. So antenatal or prenatal. So it is the before birth. So both are the one and the same. And postnatal, as the term itself suggests, post. Natal means after the delivery. So postnatal. So it is the term which indicates after the birth of the baby. And trimester. So this trimester term we are using repeatedly and very oftenly. And this pregnancy period, whatever pregnancy period is there, no, it is divided into three sections: first trimester, second trimester, and third trimester. And what and all, because there are specific changes that are happening during these trimesters, since it contains 3 months, each trimester contains three months, so only it is called as trimester. And even whenever we are taking for postnatal yoga classes, so in 85 hours it is there. So even that period is also like first trimester, second trimester, and third trimester we are going to divide. And based on that, we are going to teach specific yogasanas to regain the strength. So before the delivery of the birth of the baby, so we are dividing into three sections: first trimester, second trimester, and third trimester. And for each trimesters, there are specific yogasanas, specific breathing practices, specific asana, specific pranayama, meditation, mantra chikitsa, everything is there. And after the delivery of the baby, so mother should regain to her original size and her original strength she should regain. For that purpose also, it is divided into three trimesters, and specific to that, we are going to advise the asanas, pranayama, and meditation. Next, coming to first trimester, so it is when before the birth of the baby, so when the lady is pregnant. So first trimester, the first 14 weeks of pregnancy, it is called as first trimester. Okay, then second trimester, the time when it starts from the 14 weeks to the 26 weeks, when it starts, okay, immediately. So means at the end of the 25th week. So that is called as second trimester. And third trimester, it starts from the first day of the 26 weeks and continues till the delivery happens. And one more thing, here normally what we tell, how many months, what is the age? So usually we tell like 6 months baby, 7 months pregnancy is there, like that we are going to tell. But in medical terms, we are not going to tell like month wise. It is, we are going to tell the week wise things. So that is first week, second week, third week, fourth week, like that we are specifically in telling. So 14 weeks, it means like in general term, in a normal term, it is nothing but 2.5 months. Okay, so like that we are going to tell. So but in medical terms, that is considered as weeks, and it is very important when we go with the weeks, because the baby development is dependent on that. So even how the baby is there in the first week, second week, then fourth week, sixth week, eighth week, like the whole pregnancy, So embryology is there for your syllabus. So in coming classes, you will come to know about that. Then amniotic fluid. So amniotic fluid is the fluid which is present in the uterus, and it is surrounding the baby. And it is also called as waters. Then amniotic sac. So what happens if suppose this is the uterus? Think this is the uterus and baby is not present in the uterus as it is. There is actually one more bag, one more sac is there, nothing but something like a bag structure. So it contains the water that is called as fluid, amniotic fluid. And that bag, whatever that bag is there, so that is called as amniotic sac. Then antepartum hemorrhage. So this is the one term you are going to come across while dealing with the complications. So antepartum hemorrhage, it is nothing but bleeding from the vagina during the pregnancy. In some cases, some complications, some of the condition, lady may feel like bleeding is there or spotting is there. So spotting, usually it is not considered as the antepartum hemorrhage, but bleeding happens sometimes. Nothing but no, abortion is going on like that. So it is called as antepartum hemorrhage. So it is actually not a good term. Then birth canal. Birth canal is nothing but it is the passageway from where the baby is coming. So it contains the cervix and vaginal part. So from here, the baby is coming out through the canal and during the childbirth. Then cesarean section. So it is also called as LSCS. LSCS is nothing but lower segment cesarean section. So what happens even whenever we are dealing, no? So umbilicus is there. So our Nabhi Pradesha. So below the, if this is the abdomen and here umbilicus is there, so cut will be taken down here. And from here, it is baby is taken out. So that is called as, because we are taking in the lower line. So for that reason, it is called as lower segment cesarean section. So LSCS, and even it is also called as C section. So nowadays what happens if this is the umbilicus, and here from here the pubis part is starting. Okay, from here pubis part is starting. Just above the pubis line, cut is taken. So it is nothing but for the beauty purpose. So if just below the umbilicus it is taking, so that mark is visible. So for that reason, the cut is taken little bit below nowadays. So it is something like it is not so much visible. That is whatever it is, but it is called as C-section because it is lower segment. Then cervix. Cervix is the narrow lower end of the uterus. So if this is the uterus, uterus will be in this shape. So here, whatever this part portion is there, no? So that is called as the cervix, and it is very much important during the labor. Means when the baby is taking birth, from cervix only the baby is coming out. Then conception. So conception, it is the term where one sperm and one egg, they are going to join, and that gives rise to the baby, or a small baby, or you can tell it is an embryo. It is told medically like an embryo or baby in normal term. So conception is also called as fertilization or impregnation. So meeting, one sperm is there, one egg is there, just combining them is not called as a conception. So it should go and attach to the wall of the uterus, then only it is called as conception. So for that reason, it is also called as impregnation, means going and attaching to the wall of the uterus. Then insemination. So because whatever semen is there, so that is going to the ovary, ovum, and ovum is the female egg or female cell. So sperm is going and attaching to that, it is going inside and doing the fertilization, and embryo is forming. For that reason, it is also called as insemination. Then contraction. So this contraction term you will come repeatedly come across when we are dealing with the labor, normal labor, how the normal baby comes out. So contraction, it is the term where if when baby is coming, so during that time, whatever abdominal part is there, uterus part is there, that will become very tight. And again, it will relax and it will become tight and it will relax. So whatever it is doing, for that region, it is called as contraction, and it is necessary for the baby to come out, and it is actually the painful, a little bit painful. And croning. So croning means, if uh, croning means that when the baby is coming out through the cervix, so we can see the head of the baby. So that is called as the croning. So when the baby's head is coming and touching, so that is called as croning. So here you can remember that Three Idiot film is there. So at that time, during the labor, he does with the vacuum cleaner. Usually it will not happen like that. During that time, Kareena Kapoor tells, see, croning is there or not, croning is there or not, like that she will tell. So croning means that baby's head, whatever the head is there, that is coming out and you can see through your eyes. So, or you can palpate through the fingers. So that is called as croning. And dilatation. Dilatation, it is the term, it is usually used for the cervix. So cervix means it is the lower part of the uterus from where the baby is coming out. So usually cervix uterus is there like this. Here cervix will be there. So cervix, it will be whenever we are touching, so we can feel like this. So round, it will be like this. So first we have to insert, and if one finger it is going, so it is called as 1 centimeter or 1 finger dilatation. Then if 2 fingers are going, then it is called as 2 finger dilatation. Then if progresses like 3 finger or 4 finger dilatation, so come on. So that is considered as the this one, dilatation. Ectopic pregnancy. Ectopic pregnancy, what happens? Baby should grow in the uterus only. It is compulsory that baby should grow in the uterus. What happens sometimes? The baby means the egg, female cell get fertilized by the male cell in the fallopian tube, and baby will not come to the uterus. So that will be staying there itself, and it will start developing there only. And fallopian tube is only very small structure, and when the baby develops, so what happens, that will burst. So that will means it is actually very painful condition. We need to go for immediate surgery. Lady can't tolerate that pain. So that is called as ectopic pregnancy. And fallopian tube is the very commonest site where ectopic pregnancy happens, and even like that. So it is very common. And it is not good also. And of course, baby will not develop in the fallopian tube. Then coming to the embryo. Embryo is nothing but it is the egg, means female egg, that is fertilizing by the male sperm. So when it is called as embryo, so suppose this is the female cell and male cell is coming here and it is getting attached. So from that period till the 8th week, means normal term we can tell as 2 months. So till 2 months it is called as embryo. Then fertility. Fertility is the term used for the lady, or usually used for the lady. So it is told like lady is fertile or not. So fertility means if whether the lady can conceive the baby and can she carry the pregnancy, that term. So that is called as fertility. Then full term, full term normal delivery. So it is called as FTND. So full term may be normal or may be cesarean. So full term indicates after the 37 weeks. So many times happens like the baby gets delivered during 35 week or 36 week, which is not considered as the full term delivery. So baby should develop properly. So it starts from the 37 week to the 42 weeks of gestation. Then gestation, it is nothing but the total length of the baby time where the baby is present in the uterus. So suppose baby may lady may deliver at 38 week, 39 week, or even 42 week. So total that period is considered as gestation period. Then neonatal period. So neonatal means whenever the baby is coming out, no, it is called as, there are different terms given for that. Neonatal period, it is considered from the baby's birth till it becomes 4 weeks of age. So till the baby becomes very small, no? So it is till 1 month, it is called as neonate. Then newborn. So a baby between birth and 4 weeks. So neonate and newborn both are one and the same. So if you are getting any terms like newborn or neonate during your scanning postnatal yoga classes you are taking, so if that is term you are coming across, so it is called as up to 4 weeks. Then ovum. So ovum is nothing but the female egg. And ovaries are the one, it is, they are present only in females. Okay. So actually what happened, when we are giving one viva, so one of our classmate male, okay, so during anatomy viva, external person came, and even he was male person. He showed one organ and he asked, what is that organ, just name it. So he was not able to name it. Then that external examiner, he told, see, it is used for the baby development. Then also he didn't tell. He was telling like it is kidney, it is liver, something and all. Then after that, the external examiner told, it is not present in me, and also it is not present in you. Now you tell. Then you know what he told? He told brain. Then external examiner failed him. So it is actually the ovaries. Of course, it is not present in the male. It is present in the, means it is a just joke. Okay, it was happened during our study period. So I just remembered and I told. So they are nothing but the ovaries, and they are producing the ovum, and they are actually they release the female eggs in the fallopian tube. Then ovulation. Ovulation is the period where the mature egg, female egg, it from the ovary, it comes and it is ready for the fertilization. So it is nothing like every day. It is for males, it is different, but for females, if they want to get pregnant, they should have this sexual activity only during ovulation period. So you will come to know your ovulation period and everything during the menstrual cycle in detail. We will tell. So it is usually it lasts from 15th day to the 18th day. So during that time only the partner should try for the baby. So that is called as ovulation period. And perineum. Perineum, it is the lower place where vagina and anal canal or anus is present. So the total part is called as perineum. Then placenta. Placenta is the organ which is present in the uterus, and it is attached with the baby through the umbilicus. Okay, and it is also attached with the uterus of the mother. So from here only all the nutrients, oxygen, everything baby is getting. So it is getting exchanged through the umbilical cord and placenta. And postpartum hemorrhage. So postpartum means after the delivery of the baby, sometimes what happens, the bleeding will not stop. Maybe because of any rupture of the vessels or anything, and it is actually a very dangerous condition. It is very difficult to manage. So during that time, it is actually an medical emergency, so we need to manage that one. So experts, they will manage in the hospital. Okay, so then coming to the premature baby. So premature baby, it is the one when the baby borns before the 37 weeks. So at least the baby should complete the 36 weeks. So total, in layman term, total it should complete the 36 months. Then if it is starting in the first day of the 37 week, also it is well and fine, but it should complete 36 weeks. So if it is not completing the 36 weeks, so that is called as premature baby. Then abortion, it is nothing but the termination of the pregnancy, and it can be achieved through the surgical procedure or by taking any drugs. But the thing is, it should be done, it should be performed under medical supervision only. Okay, not by any other things. So spina bifida. So spina bifida, what happens? So it is the term. So spina bifida, when the baby develops, no, in the womb, so it is the brain. So next it is attached with our spinal column. Our backbone is here, no. Between that we can feel that spine. So that it is actually the nervous system of our whole body. So only doctors are advising folic acid intake, especially in the first trimester. So usually it is better if they are taking up to second trimester, but at least for the first trimester, they are advising the folic acid intake. So it is mainly responsible, or it is very much needed to prevent this spina bifida. So what happens during this period? So total backbone, it is not closed completely. Some of the nerve endings, so nerves are coming, no, from here. So the some of the nerves are open, and it is not closed completely, but no need to worry, we can manage it. But some of the surgical procedure and other things are needed, but of course we can manage it. Then spontaneous labor. Spontaneous labor means usually it will not happen in the primary. Means who is giving the birth to the first baby. She is called as primary. So usually it will not happen to the primary, but it may happen like fourth baby, fifth baby. So immediately the baby is coming out without any help. Then that is called as spontaneous labor. So many times we find in our clinics, also in our hospital, like the ladies will come with the progress in the labor with the baby, like that. So many things happen. So that is called as spontaneous labor. And stillbirth. So stillbirth is the term where the baby is dying, means baby's death before the 20 weeks of gestation. So that is called as, means before the birth, in the womb only if it is dying. So that is called as, no, sorry, before the 20 weeks, it is called as abortion. After the 20 weeks, if it is dying, so that is called as stillbirth. Then umbilical cord. Umbilical cord is the one which connects the placenta to the baby, and it is very much needed for the transportation, exchange of the vitamins, nutrients, and everything. Okay. So any doubts you are having for today's class? You can ask. You can unmute and you can ask. No worries. Many of you have video is off. Okay. किसी को कुछ पूछना है तो पूछ लीजिए, or else we will go with the meditation class.
हेलो मैम।
हाँ हाँ, बोलिए मीता मैडम।
टर्मिस्टर का जो बोला था 2.5 मंथ 14 वीक्स का रहता है, तो
क्या?
वैसे 14 वीक्स
हाँ
2.5 मंथ्स रहता है ना
हाँ
टर्मिस।
हाँ
हाँ, तो
हाँ।
वैसे सबका बताओ ना, मतलब कितना अपने को वीक में, मतलब मंथली बोलना रहता है तो कैसे बताया जाता है?
नहीं, यूजुअली क्या होता है, फर्स्ट ट्राइमेस्टर, सो
हम्म,
हम बोलते हैं कि फ्रॉम बर्थ टिल द स्टार्ट ऑफ द 14th वीक, लाइक इट इज नॉट लाइक 14th वीक स्टार्टेड, 13th वीक कंप्लीटेड, फ्रॉम
तो
0 to the 13th वीक कंप्लीशन. सो क्या होता है यूजुअली, इफ वी आर कंसिडरिंग 4 weeks 1 month, so it becomes like 3 months 1 week. But in medical terms, first trimester is considered up to 3 months 1 week. So it is the end of the 13th week. But usually क्या होता है, when we are giving the this one yoga classes, whenever we are taking yoga classes, in the immediately, so it is natural that the pregnancy test will not be known till 1.5 month. So क्योंकि वो HCG हार्मोन रहता है, so that hormone should come in the urine, and that urine whenever they are putting over the pregnancy kit, so then only the line is coming, then only
कमिंग।
it is confirmed, then only it is confirmed. So till 1.5 month or almost like say 6 weeks 7 weeks, we will not understand that the lady is pregnant. Only
हम्म,
first thing, she has to miss her periods, then after that she has to go for the checking of the on the UP ticket, and third thing, if it is not like that, so it should come positive on that. So in the initial stage, what happens, it will come very light line will come, it will not come very dark. So when the hormone is getting means secreting, then it will come dark. So that hormone line, it should come as the dark. So almost say you will not get a client till 1.5 month, so because they will not be knowing only. So the lady whoever is coming for you for the yoga class, so that will be after the like say 6 weeks only. So you have to consider that as the first trimester. And many of the ladies, many of the doctors, they don't means they don't advise yoga classes in the first trimester. And if you are getting clients, no, so you should tell that whether your obstetrician, your doctor has told to practice yoga or not. Like that, you have to ask her. And if they are telling yes, they have told, then only you have to take that client. Okay.
ऑलमोस्ट 3 मंथ के बाद ही बोलते हैं ना?
हाँ, यूजुअली 3 months के बाद बोलते हैं. मेनी टाइम्स आई नो, इवन आई गेट लाइक 4 months 5 months. वन टाइम आई गॉट इन द
क्या?
8th month that. हाँ, so only in the last days they want to do some yogasanas like that. So
और
it happens.
सॉरी, वन मोर क्वेश्चन कि हर एक मंथ का अलग अलग आसनास रहते हैं क्या, मतलब लाइक
हाँ हाँ,
यू नो?
हर देखो, हाँ हाँ, देखो क्या होता है, फर्स्ट ट्राइमेस्टर अलग रहता है. क्योंकि क्या होता है, फर्स्ट ट्राइमेस्टर में हम ज्यादा योगासना नहीं बोलते हैं. सो बिकॉज इन फर्स्ट ट्राइमेस्टर इट इज मोर प्रोन फॉर द अबॉर्शन, बिकॉज द बेबी इज वेरी स्मॉल. एंड यूजुअली क्या होता है, आजकल प्रोजेस्टेरोन हार्मोन भी देते हैं, बट if they are not giving also, we don't know whether the doctor has advised or not. And usually अभी क्या होता है, एज भी ज्यादा रहता है लेडीज का. ऐसा नहीं है कि पहले कैसे होता था, 16-17 ईयर्स के प्रेग्नेंट हो जाते थे, शादी हो जाता था प्रेग्नेंट. अभी यूजुअली नॉर्मली 25 ईयर्स के बाद ही हमें मिलते हैं. सो मोस्ट ऑफ द टाइम्स व्हाट हैपन्स, दे आर more vulnerable. So what happens, we should not give heavy exercises. We should go with the minimal exercise and minimal pranayama and meditation. So that you will come to know during the class. We will take trimester wise yogasanas and what and all you can give. And second trimester में क्या होता है, second trimester is actually the safest one. Second trimester, so हम लोग normally दे सकते हैं कुछ आसनास, कुछ बोल सकते हैं. Then थर्ड ट्राइमेस्टर में मतलब फर्स्ट ट्राइमेस्टर में हमें जस्ट वो मेंटेन करना है, and because of the hormonal influences there will be more of emotional changes, so that we need to manage. In the second trimester we should strengthen her thighs, her pelvic region, then her breathing practices we should increase because baby needs more oxygen. Then in third trimester we should advise some of the practices for the normal delivery, and if she is continuous yoga practitioner, we can advise more and more yoga classes. And during all these 3 trimesters we should go with the mantra chikitsa, dhyana chikitsa, and sangeeta music therapy and other things, that is there. Okay, yes. इससे और को कुछ पूछना है? Yes, मोनिका मैडम आपने अनम्यूट किया है, you have unmuted yourself. Do you want to ask something? Okay, actually most of you people have
हेलो हेलो
yes,
मिस
yes, yes, Priya
मिस
madam, yes.
एक्चुअली यूट्रस में जाने का रीजन क्या रहता है? बेबी का आपने बोला था यूट्रस में प्रेगनेंसी होता
क्या
है,
पार्डन?
ट्यूब में आपने बोला था ना प्रेगनेंसी।
हाँ, so that is
हाँ,
there is
उसका
no
रीजन
reason.
क्या होता है? बेबी अपने आप यूट्रस में नहीं आता है तो उधर अटक जाता है कि उधर ही हो जाता है? उसका रीजन क्या होता है एक्चुअली?
हाँ, यूजुअली सी देर इज नो रीजन, सो उसके लिए रीजन तो नहीं है, लेकिन नॉर्मली क्या बोला जाता है कि मे बी क्वालिटी ऑफ द ओवम और मे बी द क्वालिटी ऑफ स्पर्म इज नॉट गुड। हाँ, क्या होता है यूजुअली आफ्टर द 40 एज मीन्स फीमेल का जैसे एज होता है, इवन देर इज एज फॉर द मेल्स आल्सो, तो मेल्स के लिए भी
हाँ
थोड़ा एज रहता है स्पर्म क्वालिटी के लिए। तो आफ्टर सर्टेन एज इवन देयर स्पर्म क्वालिटी विल स्टार्ट decaying, though semen is producing good quality, but it should contain some lax together sperms, and that sperm should have the proper strength. तो sperm का problem क्या है? So there are many things for the sperm. ओम एग क्या रहता है? वहीं पर रहता है, so but sperm ऐसा नहीं है, it has to travel till the egg and it should fertilize, और उसका क्वालिटी और उसका क्रोमोसोम उसका सब कुछ बहुत अच्छा होना है, एंड इट शुड हैव प्रॉपर एनर्जी, एंड बोथ ओवम एंड स्पर्म आफ्टर फर्टिलाइजेशन वो नीचे आना है, दैट शुड कम. सो यूजुअली इट इज मेनली रिलेटेड विद द क्वालिटी ऑफ द ओवम एंड स्पर्म, बट नो रीजन. बस मैं अपने प्रैक्टिस के हिसाब
नहीं सर, आवाज
से
क्रैक हो
हम
रहा है और उसको वीडियो भी हाँ ओके मैम। हेलो, आईवीएफ में
हेलो
मोस्टली
हेलो
हेलो, आईवीएफ में मोस्टली प्रेगनेंसी ट्यूब में जाके अटकते हैं क्या? ऐसा भी है क्या आईवीएफ करते हुए?
हाँ, सो आईवीएफ में क्या होता है? आईवीएफ
मिस कट योर वॉइस मिस, आई
है,
कांट
हेलो,
मिस कट योर
हाँ,
वॉइस।
आईवीएफ में हाँ,
मैम कट योर वॉइस, also finish your
आर
video.
3 is okay, wait, so audible in the
No miss.
what happens in the since we are giving with the hormonal injection, so because of,
हाँ
so there
miss
is
your voice
chances, wait, because of hormonal injections there may be chances, but not mentioned like that. So बुक में ऐसा कहीं पे भी नहीं है, बट हम लोग उस हार्मोन देते हैं, इंजेक्शन आर्टिफिशियली हम फर्टिलाइज करते हैं, इसके वजह से ये सभी होता है। ओके ओके फाइन।
आपका
Okay,
वॉइस
fine.
ब्रेक हो रहा है, हमें कुछ समझ में नहीं आ रहा, आप कल समझाओगे तो
I have
अच्छा रहेगा।
messaged. No, I have messaged. Check it. I have. So you can. किसी और को कुछ डाउट्स है? किसी को कुछ डाउट्स है?
No doubts for now.
Yes. Doubts? Doubts? हेलो राजीव सर, आप कुछ शेयर कर रहे हैं?
Namaste. Yes, yes, yes. Who want to join us? Get free pre-recorded food and nutrition course.